So our presentation is on intuition and decision making, and we're going to cover two texts. My name's Lauren.
And I'm Jacob.
So the first text is Exploring Intuition and Its Role in Managerial Decision Making by Eric Dane and Michael G. Pratt. And this text was in the Academy of Management Review Journal. So this text discusses how decision accuracy is often inversely related to decision speed. So how can we make high quality decisions quickly? Intuition might be the answer. The definition of intuition has a bit of confusion around it. It's often associated with things like gut feelings, hunches, or feelings of knowing per se. The official definition, according to this text, is emotionally charged judgments that arise through rapid, non-conscious, and holistic associations. Essentially, it's our inborn ability to synthesize information quickly and effectively. The text talks about how managers use intuition for strategic decisions. EMS personnel, firefighters, surgeons all rely heavily on intuition when they have to make decisions quickly. And intuition decision making is also much faster than other types of decision making. So there's a clear distinction between intuitive decision making and rational decision making. Intuitive decision making involves learning from experience and understanding without conscious attention, and it focuses on recognizing patterns rather than making connections through logical considerations. Whereas rational decision making involves the use of systematic procedures designed to thoroughly assess all pertinent information and evaluate costs and benefits to ultimately make decisions based on conscious deliberation. The text covers a number of factors that influence the effectiveness of intuitive decision making. The first one being that schemas, which represent knowledge about a concept or a type of stimulus, must be complex and domain relevant, where a domain is a specified sphere of activity or knowledge. The second one is explicit learning has been found to positively influence intuitive decision making, which is when individuals are consciously aware that changes are occurring to their underlying knowledge bases, as opposed to implicit learning, which is the process where one acquires knowledge outside of their conscious awareness. So explicit learning positively influences intuitive decision making through things like duration, repetition, and feedback. For example, research has shown that a 10-year period of intense preparation may be necessary to be able to adequately use intuition in decision making. Then there's paying attention to stimuli in question, which basically means paying attention to your environment, even if you can't fully understand it, will help you make intuitive decisions. A judgmental problem structure can also be good for intuitive decision making. Judgmental means any problem involving maybe politics, ethics, aesthetics, behavior judgments, or any other things that don't have objective criteria or demonstrable solutions, as opposed to definite objectives for success, which are clear. And the last one, which kind of goes along with judgmental problem structure, environmental uncertainty is also a good environment for intuitive decision making, because there are multiple plausible alternative solutions, not one super clear answer. This is a diagram outlining the factors I just went over and showing how they're all related. So I'm going to pass it to Jacob now.
All right, so the second text we covered for this project was Reviewing Intuitive Decision Making in Uncertainty, the Implications for Medical Education, written by Catherine H. Hall, who is a medical professional herself, as well as a professor teaching classes on medical decision making. And so she breaks her paper up into 4 main topics, the first being sources of uncertainty, which kind of boils down to 3 main different sections. Technical uncertainty being kind of just within the structure of the within the medical structure, um, such as like lack of information, insufficient information available for these new conditions patients may have, as well as the changes in technology. The doctor that is with the patient may not be fully up to date on these technological changes, as well as if the doctor themselves just has a misunderstanding of basic medical concepts that can lead to uncertainty in their decision making. And personal uncertainty kind of relates to the relationship between the doctor and the patient. There may be complications that the patient can't communicate their wishes to the doctor, leaving them unknown, such as if they're in a coma or have a speech impairment that'll hinder them from being able to communicate their wishes, as well as if the doctor and the patient are like friends or know each other, then these emotional ties between them could lead to more uncertainty. And conceptual uncertainty kind of just covers all the unknowns of the future, whether that's technology changes as well as the patient's condition furthering or changing in any way in the near future. It's just anything that's kind of out of prediction, unable to tell at the current time of making the decision. She then goes in to cover the responses to uncertainty. And one of the biggest things Paul highlights is that doctors often lead to action when they are faced with uncertainty. They do not want to feel like they aren't doing anything, and they want to take action, um, make them feel like they're doing something not only for themselves but for the patient to satisfy them, not leaving them in limbo. And then she goes on to cover denial, and there's not only denial to protect the practitioner but the patient as well. And for the practitioner, there's often denial of uncertainty to help maintain a clarity within the doctor's mind so they don't second guess themselves, as well as giving themselves an illusion of control of the situation. And for the patient, of course, the patient wants to feel safe in the doctor's hands. So they're going to give kind of limit the limit the uncertainty so the patient feels like they are in that comfortable state with the doctor. She then covers some of the errors and biases in expert intuition. And one of the biggest causes of error is heuristics, which they're very useful in many cases. They're decision-making strategies, and they allow you to base decisions on a few relevant predictors. The problems come into account when people are strictly following these predictors, and um, as soon as they recognize a few of the predictors, they immediately jump to the decision and use that heuristic in when it might not be necessarily the most applicable choice for that situation. She also covers many different types of biases, and just a few of the most common to highlight is the way information is presented. It leads doctors to search harder for evidence that confirms a decision rather than opposes. And once they have this information, they often are going to overemphasize it to support their decision rather than taking all the information into account and making maybe the safest decision in that case. Um, Another bias is sociocultural bias, such as basically just the patient's background, their social class, income, etc. And that can lead to some biases because of factors of, oh, like how close does the patient live to the hospital in terms of like their social class or income, what treatment can they afford depending on what decision is made by the doctor. So then it gets into the implications for medical education. And one of the biggest things Hall wants to make clear and recognize is that biases are part of human nature and they're going to influence doctors and patients' decisions. One of the biggest ways to prevent this bias making an impact is education. And so Paul actually teaches some courses concerning medical decision making, and she just works to increase the awareness of biases present and how they influence decisions. And like I said, being aware of biases is the biggest key to resisting them and making the clearest decision the practitioner can.